Sweet syndrome, also called acute febrile neutrophilic dermatosis, is a skin condition that appears quickly. It shows up as painful, red or pink bumps that look like a bruise. The rash often comes with a fever, so doctors call it febrile and neutrophilic because a type of white blood cell called neutrophils gathers in the skin. The exact trigger is not always clear, but three main groups are known. Infections like a cold, urinary tract infection, or pneumonia. Cancer, especially blood cancers, such as leukemia. Medications, drugs such as colony-stimulating factors, antibiotics, or anti-seizure pills. Think of it like a fire alarm. The body reacts to a signal: infection, tumor, drug, and calls in a lot of neutrophils, which then cause the skin rash. Typical signs you might notice include sudden fever, often above 38 degrees Celsius, 100.4 degrees Fahrenheit. Tender raised patches that are bright red, sometimes with a violet edge. The patches grow fast, often within 24 to 48 hours. They usually appear on the face, arms, neck, or back. The skin may feel warm to touch, like a mild sunburn. Imagine waking up with a few round, painful red spots that look like pimples, but are much larger and hotter. That's the rash of Sweet syndrome. Doctors diagnose Sweet syndrome by taking a detailed history: fever, recent infections, cancer, new medicines. Doing a skin biopsy, which shows a dense collection of neutrophils without infection. Running blood tests to look for elevated white cells or signs of an underlying disease. Treatment focuses on stopping the inflammation. Systemic steroids, for example prednisone, are the first line and often clear the rash in days. If steroids can't be used, other drugs like colchicine, dapsone, or immunosuppressants may be tried. Treating any hidden infection, cancer, or stopping the offending drug is essential. An easy way to picture treatment is to think of a stop-the-fire team. Steroids are the water, and removing the cause, infection, tumor, drug, is turning off the gas supply. Because Sweet syndrome is usually a reaction to something else, true prevention means managing chronic illnesses well, for example, keeping infections under control, monitoring cancer patients, discussing new medications with a doctor, especially if you have a history of sweets, reporting early skin changes to a healthcare provider so treatment can start before the rash spreads. While you cannot guarantee it will not happen, staying aware of triggers lowers the risk. Targeted biologic therapies, such as IL-1 blockers, anakinra, and TNF-alpha inhibitors that have helped patients who don't respond to steroids. Genetic studies hinting at specific immune system, gene variants that may predispose certain people. Improved imaging and lab techniques to find hidden cancers earlier, when sweets is the first clue. These developments are like adding more tools to the doctor's toolbox, offering options when the standard fire